Hi, everyone, and welcome back to Inside Student Affairs. This is an opportunity for members of the alumni community, members of the parent community, and those who care about the issues that we're facing at UNC to get under the hood, to go inside student affairs and meet our professionals and meet the people who make the work happen. Today, I have with me Ken Pittman, someone that I'm really excited about. He's the executive director of campus health. And he's going to join us today to talk about the work that they're doing, especially how we're executing this work during COVID-19 and what we need to think about as we get back to normalcy. Welcome, Kim.
Thanks, Zach. It's great to be here. I appreciate the invitation.
Absolutely. As always, sharp with your bow tie. I love that.
Do my best.
And so, Ken, I just want to thank you for joining. And as I mentioned, Inside Student Affairs is an opportunity for many that don't get a chance to see our work happen to meet the people who do. And so I wanted to ensure that they had a chance to meet you, and always start off by asking people to share a little bit about themselves, how long you've been at Carolina, a little bit of the work that you do, and how long you've been here.
Perfect. Well, I've been at Carolina for what will be 10 years this coming summer. That doesn't seem possible. My background is in hospital management. So I've spent about 25 years in the hospital environment, did healthcare consulting, ran a hospital in the eastern part of the state, did hospital turnaround work. I've lived in the Triangle for the last 20 years or so. As you know, and hopefully this will not cause all of our listeners and viewers to discount any credibility I have, but I did go to a school about 8 miles down the road. But I've still been welcomed into the Carolina community, and am doing my very best to ensure the health and well-being of Tar Heels.
Well, we appreciate that, and we will not hold that against you at all.
Thank you.
We'll try our best. One of the things that I want to make sure that people understand is the breakdown and the structure of campus health, the number of people that you employ. And then one thing that's really important, and we'll get to some of that later, is the collaborations that you have around campus. Because I know you can't do your work alone, but tell us, a bit again, the structure of your office, and again, how many people you employ and what they do.
Perfect. Well, first of all, Campus Health is a 100,000 visit, 150 staff member, multi-specialty medical group, an integrated healthcare practice that offers both medical and mental health services to the students, postdoctoral fellows, and their spouses and partners here at Carolina. We have 2 pharmacies where we do over 60,000 prescriptions a year. We're inclusive of both the medical side, as I said, counseling and psychological services, and student wellness. We're about a $30 million operation. We're one of 11 college health centers across the country that's accredited by the Joint Commission, which is the same accrediting body that UNC Health and Duke Medical Center and Wake Health are accredited by. And so we have a full range and continuum of services for our students, both primary care and in the specialty space. And some of the alums might be interested to know that we're one of the very few college health centers across the nation where sports medicine is structured within campus health, as opposed to being structured within the athletic department.
Yes,
so the way I like to think about that is that we really focus on the medical and mental health needs of our athletes within a healthcare organization, as opposed to within an athletic structure. The NCAA is really in support of the model that we have in place, and we have many other Division I universities that are looking at our model as something that they might adopt in their institutions.
No, well, it sounds like Carolina's being a leader yet again.
Exactly.
Even in this space, and and I think, like you said, that's really, really important for them to know, because not only are you able to support our Division I athletes, but we have lots of student athletes who are club sport athletes who are in other areas that you get a chance to support as well. So I don't want that to be lost. One of the things that you also have
all all of us want to be athletes,
That's
both
right.
the
All
real
of us, oh,
athletes and the wannabe athletes. I fit
myself
in the latter
included. Myself included.
category.
Um, and one of the things that you also do is you operate the pharmacy, the student pharmacy. And so,
Exactly.
with that, what have you seen as a change in the way that we've had to dispense medications for students because of COVID-19 and stress? Talk to us a little bit about that work and how you've seen it change over time.
Sure. That's a great question. We have two pharmacies on campus. One is located within our campus health building, which
Mhm,
is between Keenan Stadium and the hospital. The other is in on the third floor of our student stores on South Road. And so our students are able to access the pharmacy both for prescriptions and also for over-the-counter medications, where we're able to offer below uh, significantly lower cost than you would find in many of the retail big box pharmacies. We also have implemented within the last year vending machines on campus so that students, we call it Healthy Heals to Go, and
mhm,
students are able to get over the counter medications and products when our pharmacies are closed at
mhm.
those same at that same pricing. We have had to make adjustments during COVID. We've had many students that have wanted to access our pharmacy, but they are doing so outside of a medical visit. And so we have curbside pickup that we've developed for students during COVID, where they're able to drive up and our pharmacy technicians actually take their products to them
Okay.
and their prescriptions to them in their vehicle. So we've done some things that have adapted to the COVID environment to make people safe and to make people more comfortable in accessing our pharmacy services. We also have 6 doctors of pharmacy, so we're staffed only with PharmDs in our pharmacy that are really able to work with students, many of whom may be accessing a medication for the very first time, at least away from their parents. And so they really need to know how that medication may complement or interfere with either other medications or other activities they may be engaged with. And so we have an opportunity for our pharmacists to engage with those students.
And so that gives context to the 100,000 visit operation that you run, because as you can imagine that those are a lot of touches. Absolutely. Now, for parents and alum who are there, with the full context of your work, how can someone be referred to campus health services?
Well, every student pays a health fee as part of his or her tuition and fees, and
Okay.
that provides them with eligibility to access campus health for primary care services,
Mhm.
um, and for a number of services for which we do not bill insurance. So we do not bill insurance for primary care visits or um, counseling, brief therapy visits. Uh, we don't bill insurance for gynecological visits. And so we do that because we don't want any issues regarding access or any barriers to access. Once students access campus health, they then we are able to bill their insurance for services that are not covered under that health fee. So think lab test, X-ray, um, the prescription, a visit to one of our specialists, like in orthopedics. And
Mhm.
so we're billing insurance just like any other medical practice would. And Campus Health is in network with 94% of all of our students' health insurance. So
Wow.
we're an in-network provider. They're getting the benefit of that in-network provider, and any copay or co-insurance is put on the student account. And we make sure that we have charges with and rates within our insurance contracts that
Mhm.
keep the access to the care that we're providing very affordable for our students. We also then have for students a full-time referral coordinator so that if there are any services that we don't provide, but that our providers feel like that students need, think specialized diagnostic tests,
Mhm.
access to specialists at UNC Health, then that referral coordinator is working with that student to help make her or his appointment that's consistent with their academic schedule and it's going to meet their needs, and also make sure that we're referring them to an in-network provider with their insurance.
No, 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 that's fantastic, and I think amazing for people that don't have the ability to get under the hood. Um, and so one of the things that we always get asked from our external community is about how things have changed from COVID and what have you learned? Like how will you be able to adapt what you do for students once we get back into a normal environment?
Sure. That's an interesting question. I think that we've done a number of things, obviously, to keep our students safe and well during COVID. There are some things that I feel like that we've done that are very science-based. In fact,
Mhm.
most of the things that we've done a few things, admittedly, that are also related to optics.
Mhm.
The curbside pickup that I mentioned for prescriptions, I
Mhm.
think in some instances that's more about optics, because I would say that as a healthcare provider, we're actually one of the safer places you can be because
Sure,
we know all of the infection control
sure.
work and we're all in protective equipment. But so I think that we've done all of those things well. In the
Good.
COVID environment, campus health has been most involved in testing. We've
Mhm.
provided our students with over 50,000 tests
Wow.
to date, both in the symptomatic and the asymptomatic space. We are doing all of the contact tracing as it relates to any student positive. So, any student that tests
Yeah.
positive on our campus, Campus Health is doing the case investigation um, and providing all of the isolation instructions and ongoing medical monitoring for our students,
Mhm.
determining who the close contacts are by CDC definition, and then reaching out to those close contacts and providing them with quarantine instruction and with ongoing monitoring. Just this semester, this spring semester, we've already managed over 1,600 close contacts and
Wow.
the quarantine that is associated. And of course, we believe that the work that we're doing to contact those students, to care for them certainly, but to contact them and move them into isolation and quarantine protocols, whether they be on campus or off campus, has really contributed to what is thus far, knock on wood, an extraordinarily successful semester
Yeah.
relative to our positivity rate among our student population.
Good. And it seems like all those things going into the fall when we expect the campus to be more open and more populated, all those things will have paid off. All
Exactly.
those precautions and precautions. So that's amazing.
Yeah.
As
The
we
other
close,
thing I'll mention, Zach, just briefly, is that we're now, of course, transitioning into the vaccination space.
sure.
And so Campus Health has been approved by the Department of Health and Human Services as a vaccine provider for our students. So once our students are prioritized, everybody's talking about what group you're in right now for vaccination purposes. We have, for example, some health science students that are already vaccinated by virtue of their clinical rotations, and they're being in group one. We have some students who have jobs that make them frontline essential workers. They'll
Right.
meet some of those categories in group three. We have some students who have chronic medical conditions or qualifying health conditions who will be vaccinated in group four, but the vast majority of our students will be in group five, the everybody group, so
Sure.
to speak. And so we are making our plans to have available mass vaccination whenever that might be, whether it be late this semester or more likely sometime in the mid to late summer, moving into fall semester, when we'll be about making sure that our students receive those vaccinations in a timely manner.
Oh, that's fantastic. And this has been great information for our viewers because we really want them to understand again how students are being kept safe, how the campus community is being kept safe, and who's doing that. And you provided this today. So Ken, thank you for your time. One of the things that we'll do, this gets played on all of our social media, gets sent out to all of our supporters and prospect supporters. And then we of course ask them to find ways that they can give and support this. And so I wanted to thank you and let everyone know that this has been yet another amazing episode of Inside Student Affairs. We come to you every single week talking about the work of the leaders that are making a difference across our campus and the way that Student Affairs is specifically holding our campus together during these tough times. So thank you so much. Good to see you again.
Nice seeing you, Zach. Thank you.
Thank you.